Joining us live now is Dr. Nicole Macrum. She is a pediatrician with Kaiser Permanente. So you've worked on these COVID vaccine trials in Sacramento. What stood out to you most?
Well, thank you so much for having me here today. This is a great topic to be discussing, and I'm glad parents have lots of questions and concerns. The vaccine for the 5 to 11-year-olds, there were some changes. So it's exactly the same contents in the vaccine, but it's a lower dose. We knew kids had a good immune response and didn't need as much of a dose. So it's 1/3 the size of the dose that the 12 and up get.
And speaking of 12 and up, if your child is going to turn 12 soon, should they get vaccinated with the child dose, or should they wait until they're 12 and get the teen adult dose size?
Fantastic question. So if they're going to turn 12 soon, best to just go ahead and get started with that lower dose now. And if they turn 12 in between the doses, they'll have an option to either stick with the lower dose or go on to the higher dose. The good thing is the kids had fantastic immune responses with that lower dose, so parents don't need to worry that the lower dose won't be effective enough.
So, Doctor, so many of our viewers have questions about long-term side effects, particularly for these young children. What reassurances do you have for them? Because there's genuine concern about fertility, but also just about other health problems for things we just haven't had time to study yet.
Another great question, and it's right for parents to be concerned, but we have great evidence based on the adults. We know now in our country, millions and millions of adults, as well as kids 12 and older, have received this vaccine. We know there is no effect on fertility, not only from a whole variety of studies, also no effect on pregnant moms who get their vaccine except to help protect them from COVID. It's true we don't have years and years worth of data, but I think a lot of us realize vaccine side effects that far out are very rare, and we really don't have time to wait that long. We want to really get our kids protected now.
Dr. Macrum, thank you so much for your time and for being a pediatrician, and especially making it through this pandemic with all of us. I'm sure it's been an especially stressful time for you and all of the other healthcare workers there at Kaiser. Thank you for your time.
Thank you so much.